What is the most appropriate next step in management of this patient? Let's see. Okay, 65-year-old woman presents to ED, painful lump in her right groin that she noticed for a few hours. Reports a history of constipation, chronic cough due to COPD. On examination, the lump is isolated or located, below the inguinal ligament and lateral to the pubic tubercle. Patient is unable to reduce the lump, tender to the touch. Okay, so let's see. So this seems like a hernia. Let's see, lateral, direct, okay, or indirect. Also, female could be femoral. Let's see. I don't think. And I don't like that. I don't like that. I think it's schedule an elective surgical repair if she can't, if it's tender. Um, I don't think it's emergency unless it's strangulated or something. Then it becomes more of an emergency. But I don't see like fever, sepsis, anything like that. I don't. Me, although with these questions, whenever you see ultrasound, it's never like a bad idea to be like, okay, let's do some ultrasound first. I'm trying to think. I haven't seen an ultrasound be used for a hernia. So, um, yeah, I think I would schedule the surgical repair.
All right, so yeah, the key thing I think it's the inability to reduce something,
Okay.
and tenderness suggests like incarceration, meaning it's trapped. You know what I mean? So you
Yes.
want to operate almost
Okay.
immediately because it can become strangulated. It'll
Okay.
die. So if you do this selectively, then the bowel could die in that pocket, which would be a huge, huge issue.
Okay.
So definitely for sure, if you have bowel that's trapped inside a hernia, right, and it's what they call, incarcerated, meaning it's stuck and you can't push it back in, then it can eventually cut off its own blood supply and the bowel will die. You know,
Okay.
so
So I was
de-
looking for like fever or something else for that. That doesn't. It doesn't need to be that.
yeah. So when you're talking about fever and more systemic issues, then at that point it's probably strangulated. That means it's like
Okay.
the bowel is like dying. You know what I mean?
Okay. Okay.
So in an elective scenario, the patient might have a hernia that can be reduced. So maybe if it's reducible, they're not having tenderness. You can be like, okay, we should probably close this hernia because you worry that it could be trapped in the future. You know what I mean?
Okay.
But right now it's trapped, right? So
That makes sense.